Hello, I am Dr. Dipanjan Chatterjee and I welcome you to our cardiopulmonary critical care unit of Medica Superspecialty Hospital. You might wonder why and what is this new term of cardiopulmonary critical care. Especially many of these patients who are having either cardiac or pulmonary diseases falling sick, they have problems with the other systems too. So, for treating these patients, there is a mixed symptoms we get. It's easier if they are treated in a specialized unit, where the physicians, the nurses are all trained in the advanced treatments of the cardiac and the pulmonary systems. Use of mechanical circulatory support, use of ventilators, ECMO support for the heart and the lungs. So all these are available in our cardiopulmonary critical care unit. And many of our patients we get are very elderly. And treating these patients needs patience, care, and eternal vigilance. So we had one of our patients, an example I can give you. He was a 90-year-old gentleman. He had a poor ventricular function, congestive cardiac failure, known COPD, having chronic kidney disease, had an exacerbation of COPD as well as the congestive failure increased. And when he was brought to the emergency of Medica, he was almost gasping out of breaths. Saturation was only 60% even on oxygen. So he was promptly intubated and he was shifted to our unit. But recovery of this patient was a long run process. He was on ventilator for 40 days. We had to do a tracheostomy for him. Fortunately, his kidney functions did not deteriorate to the extent of needing dialysis, though urea and creatinine were all raised to a certain extent. He needed inotropic and vasopressor supports for the heart, and after a few days, we started weaning this patient. Weaning a 90-year-old frail patient is not a mean task. We needed the help and active participation of both the patient as well as the physiotherapists, nurses, and the physicians. And it took 40 days for us to get him off the ventilator. And fortunately, he was on the ventilator of BPL, which is the Elisa 600. A few words about this ventilator. It's a very, very user-friendly ventilator. The whole program that you get, the console, it's very easy to use. It has all the advanced modes of that you will be needing for treating these patients. And it's a very sensitive ventilator. It responds to the changes of the patients very well. And this ventilator was there with this patient for 40 days without fail. We did not need to change the ventilator even once. So you can understand how sturdy it is. After 40 days of ventilation and then weaning, a few more days were needed for the tracheostomy to be taken off and the patient to be off oxygen, and he went home after 57 days of hospital stay. He walked home, I will say, because he was very well recovered by that time. The physiotherapists were working on him and he is a happy man now. At home, healthy, comes for checkups regularly, and we are very happy to have seen his recovery so well. Unless we see these patients, unless we treat these patients, we would not believe that a 90-year-old or 90 plus age group patients will recover so well. Many patients, the relatives come the patients are very aged, they might say that he is too old, we will not continue treatment. I advise them, see this patient. All these patients can go home if treated properly.